Hi, I'm Dr. Jim Hogg. I specialize in applied kinesiology, which gives me wonderful tools for treating a wide variety of structural, metabolic, and emotional stress type problems. I see a lot of digestive problems in my practice, and one of the more common ones I treat is gastroesophageal reflux disease called GERD, also known as acid reflux and heartburn. Acid reflux is caused when acid, which we need in our stomach to help us digest our food, gets up past the valve, the top of the stomach, and gets in the esophagus. We need the acid in our stomach, but not so much in the esophagus, and that's where the problem comes in. The valve responds to acid levels in the stomach, and the lower the levels of acid in the stomach, the more the valve at the top of the stomach gets looser, gets weaker. And conversely, if you have more acid in your stomach, you tend to have a tighter valve at the top. Acid reflux is not caused by too much acid, as is commonly thought, but rather acid gets up where it's not supposed to be, up in the esophagus. As long as it's in the stomach, we're good, but in the esophagus, it causes problems. Diaphragm weakness, the diaphragm is a sheet of muscle that is underneath your lungs to help you to breathe, but also there's an opening in there for the esophagus to go through. And I was told not to put my hands over my face. I'm going to try not to do that. When the diaphragm is weak, that opening can enlarge, and the stomach can slide up through that opening into the area where the lungs and the heart are. It can cause a variety of problems. One of the biggest problems is it causes that valve to loosen up. People can also have pain in the chest from this, and often will mimic like a heart type pain. You should never ignore chest pain, but keep in mind that it could be from a hiatal hernia. It could be a much less severe problem that can be corrected with a particular type of adjustment. But the biggest problem there, the most common problem, is that hiatal hernia throws the valve off, and you get that acid up into the esophagus where it's not supposed to be. Now, a common treatment for reflux or GERD or heartburn is to take antacids like Tums, or even worse, to take something called a proton pump inhibitor like Nexium or Prevacid or Acifex. What these do, the Tums neutralizes the acid temporarily so that what you get up in here is not burny. The proton pump inhibitors don't really stop the reflux. What they do is they stop your stomach from making hydrochloric acid, which you need to digest your food. Again, it stops the symptoms because what gets up into the esophagus is no longer acidy, but now you no longer have the acid you need in your stomach to help you digest protein, calcium, iron, and B12. And also because the contents of the stomach are not as acidic as they should be, that valve at the top of the stomach starts to get looser again. So ironically, the antacids and the proton pump inhibitors will actually create more reflux. It's just you can't feel it so much because it's not burning. Now, a big problem comes when you can't digest your food properly. Everything in your body is made out of protein. So if you're neutralizing that stomach acid, you can't digest protein adequately, and a lot of things will suffer. You need calcium and protein for bone strength and for tooth strength. And some of the things you'll see from long-term use of proton pump inhibitors like Nexium is tendency toward osteoporosis. In fact, a 2006 study from the American Medical Association showed that there's a much higher level of hip fracture when people are taking long-term proton pump inhibitors. Also anemia, more gut infections, and in the last year, proton pump inhibitors have been linked to dementia like Alzheimer's type disease and also to kidney disease. And so you have all these side effects for something that doesn't actually treat the cause of the problem. The cause of the problem is getting the acid up into the esophagus, not keeping it down in the stomach where it belongs. So what can you do about this that doesn't create more problems? Well, there's some things you can do at home. Because that valve at the top of the stomach is very sensitive to the acid levels in the stomach, what you can do is you can take some apple cider vinegar. Apple cider vinegar is a weak acid, and many patients find that they take a tablespoon of apple cider vinegar in a half a cup of water with the meals. They'll help digestion and also help keep the reflux down. Also, if you're having an episode of heartburn, try taking a tablespoon of apple cider vinegar in half a cup of water and see if it helps. If it does, that tells you that your problem is too little stomach acid rather than too much. If it makes it worse, that could indicate that you have too much stomach acid, but probably there's still probably a problem with that valve at the top of the stomach. And if it doesn't make any difference at all, taking the apple cider vinegar, then it still means that you don't have too much acid. The problem is probably still with that valve. Some people, so try the apple cider vinegar. If that doesn't work for you, some people find that taking 2 tablespoons of aloe vera juice, I like Lily of the Valley brand, Lily of the Desert, I should say, brand, is a very good brand, very high quality. Take 2 tablespoons of the aloe vera juice after each meal. Or you can take 2 tablespoons or up to a quarter cup when you're having a attack of heartburn, and that will help heal the esophagus. It's good to take anyway, even if it doesn't really help with the symptoms that much, because it'll help heal the esophagus. And also, for many people, it'll just stop the heartburn. Something else you can do, I'm going to get back a little bit so you can see this. There's a reflex point along the sternum here, all the way from every place you've got bone here, along the breastbone. That's a reflex point for the diaphragm. Rubbing that every day for about 30 seconds will help to strengthen the diaphragm, and by strengthening the diaphragm, it closes that opening where the esophagus goes through and helps or narrows it down so it keeps the stomach down where it belongs, and that can often be very helpful. Now, if your acid reflux is contributed to by sliding hiatal hernia, there's other things you can do as well. Rubbing that reflex point is very important, but also avoid eating large meals. We want to keep the diaphragm and the stomach away from each other. So we want to not eat large meals that push the stomach up against the diaphragm. At the same time, we want to avoid taking really, really deep breaths that push the diaphragm down on top of the stomach. So take normal breaths, but don't take as deep as you could possibly go, because that's going to push the stomach down on top of the diaphragm. Also avoid inverted postures like a shoulder stand or headstand in yoga. And also avoid eating large meals before bed. I would avoid eating at least an hour before you go to bed, because when you're lying down, gravity is no longer pulling the stomach down, and you're going to have more tendency to have the heartburn, the reflux, while you're in bed. Another thing you can do, speaking of bed, is you can elevate the head of your bed by putting a couple of 2x4s underneath the head of the bed, underneath the feet there, and raising your bed by about 3 inches, as you will doing this. You don't really feel it that much. You won't notice, you don't feel like you're sliding off your bed or anything, but it will give you enough of a gravity pull down the stomach and the acid to help keep that out of your esophagus. Now, when you go out, I hope you do, if you're on a proton pump inhibitor like Nexium or Acifex, something like that, I hope that you can naturally treat this and go off the proton pump inhibitor, but you need to go off it slowly. Some people can just go cold turkey and they go off it, it's fine. A lot of people find that if they try going off at once, the heartburn will come back, because the body is sort of trained to be used to that proton pump inhibitor. So if you start gradually tapering off, you'll be much more successful usually than going off all at once. Now, if these home treatments aren't working for you well enough, you'll probably want to see a doctor trained in applied kinesiology, because we have great techniques for not only treating the hiatal hernia and strengthening the diaphragm, but also improving general digestion. So if you want to find a doctor in your area who's doing applied kinesiology and certified in applied kinesiology, go to my webpage, www.drhogg.com. That's drhogg.com. Go to the bottom of the page, and you'll find a link that says find a doctor in the United States. And click on that link. It'll show you where you can find a doctor who's close to you, who's trained in this technique. Also, if you have any questions, I hope this has been helpful for you. If you have questions, then feel free to email me at drhogg@drhogg.com. It's drhogg@drhogg.com. Or feel free to call the office at area code 563-386-9494. Great talking to you.